and welcome to the 13th episode of Sense with Science. Thank you Pusat Perubatan Naluri for fueling our community outreach project, and to Astro Awani for broadcasting us live on Malaysia's premier satellite service. With the number of COVID cases on the rise and the fear of infection being a very real concern, this episode, project co-driver Professor Dr. Adiba Kamarul Zaman, infectious disease specialist and member of the World Health Organization Science Council, decided we needed to speak about the science of a COVID infection.
Assalamualaikum and good afternoon, everyone. Welcome back to Sense with Science. Good afternoon, Tan Sri, who's just come back from vaccinating. I live not very far from that center, and I see lots and lots of people eager to be vaccinated outside the PWTC. And good afternoon, Dr. Vicky, who probably has just come out of her PPE from the CAC Center in Malawat.
Not today.
Not today? Okay. So yeah, and I myself have just come back from the hospital as well. So you've all heard about the increasing number of cases in Malaysia. And when Tan Sri and Karen and I were discussing, we thought it might be useful to get people to really understand what the symptoms and signs of COVID-19 is, so that people can be berjaga-jaga and get themselves tested early, because early management and treatment is also key to reducing morbidity and mortality, severe cases in COVID-19. So we have someone here today, Dr. Vicky Ayadurai. Karen, over to you to introduce Vicky. Oh, sorry, Tan Sri Jamila, I never read the script, do I?
We have to have the series progenitor say something before we start.
Yes, of course.
Dr. Jim, your mic, yeah.
Assalamualaikum, salam sejahtera. Hello, everyone. It's nice to be back on our every Sunday rendezvous. A big warm welcome to Dr. Vicky, and also huge thanks to you and people like Adiba who are working on the front lines all the time. As Adiba mentioned, I've been really, focusing on the vaccine program, because I think that's a real, game changer for us if we're going to end this pandemic. And today, I also had the chance to visit the new PPV, which is MyTech. It's massive and very, very nice. So we will start there tomorrow. And you may have heard the announcement that there are many more centers that are being set up in KL, Selangor, around Malaysia. And also you may have seen that, USM had piloted a drive-through center as well. So we are trying to see how we can really ramp up vaccinations, so that if people fall sick, they don't fall so severely ill. And I think this is what vaccines are really important for. Now, having said that, just to follow up on what Adiba said earlier, I myself have received numerous WhatsApp messages, all sorts of anecdotes on how people, fall sick, the symptoms that they have, like, or there's no more symptoms, it goes directly to the lungs and then they just collapse. So a lot of this obviously is anecdotes, and I think it's really important we have a frank conversation today about, what might be some of the ways people present with COVID, but also what are the ways that people sometimes are completely asymptomatic, and whether that leads to severe disease or whether they just remain asymptomatic and pass it on to lots of people. So, it's really important that we educate the public so that you can be aware for yourself, for your family, for your loved ones, for your friends, and also, to be able to together for us to make sure that people don't fall so ill, before they come to the hospital. So with that, back to you, Karen.
Thank you, Dr. Jim. That's Tan Sri Jamila Mahmud, Health Advisor to the Prime Minister of Malaysia. And that is why with us today, speaking about whether we have COVID or not, is special guest, consultant, family medicine specialist, Vickneswari Ayadurai. Welcome to the show, Dr. Vicky. I hope you don't mind us calling us by your pet name. We're fairly informal here. We drop a lot of the titles because this is, as Dr. Jim has always said, a coffee chat with specialists who want to reach out to the layman, speaking the way a layperson would understand. Welcome to the show.
Thank you. Good evening, everyone. Thanks for inviting me to participate in today's session. As a family medicine specialist or FMS, I and my other FMS colleagues head the clinic kesihatan or government health clinics throughout Malaysia. We provide healthcare to the communities around us. We take care of everyone from the beginning, from the womb to the tomb, providing a spectrum of services. And in our clinics, we assess patients to see who we can handle at our clinic level and who we need to refer to hospitals. But since COVID hit us, most of our efforts have been focused on combating issues related to the pandemic. And because we are usually the point of first contact for people needing healthcare in the community, many cases of suspected COVID actually appear at our doors first for us to manage and decide what to do with them.
Okay, so that sounds fairly dangerous for you, for the practitioners at family medicine level, right, Dr. Vicky?
Yep.
I mean, you have no idea whether you're seeing somebody with a common cold or whether you're seeing a prospective COVID candidate, correct?
Exactly.
So would protocol now dictate that all family medicine specialists at the government clinics are fully PPE'd as well?
No, not at all times. We need to assess which ones we consider are high-risk cases and which ones are not. So the assessing part is a very important bit at the triaging level.
All right. So though much has been written and shared about the symptoms of COVID-19, could you please walk us through the most usual first symptoms that might point to a COVID-19 infection?
At the beginning of the pandemic, actually, it was much easier because we just had to ask people, did you recently come back from China or did you attend the Majlis Tabligh? And if you did, then you were probably a COVID case. But now with COVID all around us, it's actually become both more difficult and easier to diagnose COVID. It's more difficult because the symptoms of COVID are very, very non-specific, very general. And it's difficult to differentiate COVID from the regular common cold or an influenza. So you could have fever, cough, runny nose and sore throat. You could feel tired and lethargic with lots of body ache and headaches. You could have a poor appetite, and you could even have additional symptoms like vomiting and diarrhea. A couple of symptoms that we like to see when people come with that because they're quite specific for COVID are a sudden loss of taste and smell. But apart from that, to diagnose COVID, we also have to look for the epidemiological link. That's the connection between the patient and a positive person. If they have this history of contact with someone who actually has COVID, then all these cases presenting to us with these rather non-specific symptoms, we will definitely consider them to be COVID positive and we'll arrange for them to get tested. Previously in Selangor, actually, we used to say that anybody coming to a clinic in Selangor with fever is dengue until proven otherwise. But now the clock has changed, and with the super high numbers of COVID cases in Selangor and the Klang Valley, we say that anybody coming to one of us with symptoms of a flu or a respiratory infection is COVID for proven otherwise. And that's why it's a little bit easier to potentially diagnose a case of COVID because every other person is COVID now until proven otherwise. And while waiting for us to give confirmatory diagnosis, we will ask these patients to self-quarantine themselves until we can get them tested and the results out.
That sounds so dire, Dr. Vicky. Everyone in Selangor is considered COVID, that you're possibly a COVID patient until you are said to be negative?
Yeah, that's how it feels at the front line.
Oh my God, that's horrible. But all right, so, but not everyone has, yes, Dr. June.
Karen, if I can interject, I mean, Dr. Vicky, you're absolutely right that, COVID to proven otherwise. And I think that one thing that is very important is that our frontliners are vaccinated. Otherwise, we put them at such high risk, right?
Yes.
Jadi,
Yes.
Karen, if you don't mind, I want to translate some of those very important points that Vicky made into bahasa Malaysia. Kata yang sangat penting. Yang dikatakan ialah sesiapa yang mempunyai simptom gejala seperti sesama dan batuk ataupun dia sekarang banyak simptom termasuk juga cerit-berit, muntah atau mual, tapi yang paling ketara adalah kehilangan
Diarrhea, merasa.
That's right. Diarrhea, right? Diarrhea
dan bau.
I think Vicky, your BM probably better than mine. So you can campur.
Yeah, campur after this.
Okay, so Dr. Vicky, perhaps you can do that just ringkasan atau
okay. Okay, so dekat Selangor ni ada banyak sangat kes COVID sekarang. So kita di klinik yang menghadapi pesakit, kita angkat semua orang yang datang kat kita dengan simptom macam demam, sakit tekak, susah nafas, sakit badan, kurang selera makan, cerit-berit. apa-apa pun kita memang suspek dia ada COVID. Dan kalau dia kata dia hilang dia bau dan dia rasa dengan mengejut, itu memang kita kata ni memang COVID lah, kita kena asingkan orang ni dan periksa dia di kawasan yang berasingan.
Alright. So, but not everybody has symptoms. And even if they may actually have the virus, right? So what do we do in that respect then? I mean, if it's inconclusive until they've had a test, a swab test, what do we just send them home and tell them just isolate?
Yeah, we tell them go home and duduk kat rumah diam-diam, jangan pergi mana-mana, don't go and mix here, mix there, go lawat sini, kedai sana. Stay home until we can tell you for sure whether you're COVID or not. That's the difficult part, because if you feel well, you don't want to stay home.
Yeah, that's right. That's always the case, isn't it? It's like the problem with asymptomatic patients is the fact that they are highly contagious, but they don't feel sick. And because they don't feel sick, they're out rondering here and there, right? And that's the one that I think is fairly responsible for the spike in numbers. You know, I think a couple of weeks ago, Dr. Jamila spoke about clusters developing in workplaces becoming one of the bigger reasons for the number of COVID cases in the urban centers, right? And the need to limit contact, no matter where you are and who you're with. Just because you know someone does not mean you know empirically that that person does not have COVID. Correct?
Yep.
Okay. So when patients come into a clinic, Dr. Vicky, or a family practice complaining of the flu, what are the new protocols now?
Okay, we actually re-engineered the entire clinic structure since the pandemic started last year. We have strict protocols of who can come in and who can't. We don't have all the pengiring coming to the clinic like it's a pesta. They have to wait outside. Only the patient comes in unless they need someone to help them. So patient-patient lain semua yang datang ke klinik memang kena melalui saringan. So setiap fasiliti kesihatan ada tempat saringan di pintu luar where they will tanya soalan macam you ada demam ke batuk ke, kenapa datang ke klinik, and ada tak contact dengan COVID, ada tak tengah quarantine sekarang, because some of them who are in quarantine because they have a diabetic appointment, they feel that they have to come and see the clinic. So kita tangkap mereka dekat luar dan kita hantar mereka balik. But if they are datang because dia tak sihat, then kita akan direct them to a special area. Kita buat isolation area kat luar klinik so that nanti staff kita will go down there and check them dengan pemakaian PPE supaya staff kita terlindung. So this is okay dekat KK yang mungkin boleh kata ada kawasan luas sikit, but I feel sorry for the GPs because many of them operate out of small shop houses and they don't really have this space. They can't be isolating people on the 5-foot way. So I think a lot of them actually start seeing patients not in the consultation room, perhaps in the waiting area, and they also wear their PPE so that they are protected. But yang penting sekali untuk benda ni berkesan adalah semua orang kena jujur. Bila they come to the clinic, they have to tell the truth. Kita ada alat untuk cek suhu badan, tapi kita tak ada alat untuk cek lie detector. So kalau dia kata dia tak ada contact atau dia tak mengaku dia ada contact, we allow them and they don't have real symptoms, we may allow them into the clinic. Kalau dah masuk klinik nanti, klinik kita semua aircon, ventilation pusing-pusing dalam tu juga. So kalau pesakit yang COVID masuk dalam klinik, then they're potentially spreading COVID to everybody else who's in the clinic. So we really, really want people to tell the truth.
That is true. We have tests for COVID. We do not have tests for honesty. Lie detector tests are still not something which is a clinic is outfitted with. Correct?
Definitely.
That's so true. Dr. Vicky, is there any way of determining for sure, without a swab test, if a patient exhibiting COVID symptoms is not just suffering from the flu? Can you tell, with a certain amount of assuredness that the person is okay, don't worry, you just have a cold. Don't worry, you just have the flu.
Unfortunately, at present, I don't think we have that ability yet. We can probably do the reverse. We can more confidently say that yes, you probably have COVID, because if you come with the symptoms and you've lost your smell and you live in Selangor, then more likely that you are most probably a COVID case, stay home. But I can't tell you the reverse that, oh no, I don't think you have COVID, you're okay. So what we do is to tell everyone that if you are potentially a COVID case, again and again, please go home, self-quarantine, stay home until you are tested and cleared. And sometimes you may need a second test even if your first test is negative. The doctor will determine that based on the day of bila you jumpa orang yang positif tu, so kita decide nak buat lagi sekali ke tak, and we tell them to stay quarantined until all this is cleared.
And when a patient is found to be COVID positive, what are the protocols? What systems kick into place? Is it at the doctor level, the clinic level, which alerts the Ministry of Health that they've seen another COVID patient, and then the MySejahtera status changes?
Well, at our level, when we see a case and we've tested them and the results come back positive, then all doctors have to notify these cases into the e-notification system under the Disease Control Act. And once that name has been registered in the system, the health office staff will go into action. They will contact the patient and do a risk assessment. If the patient is elderly, more than 60 years old, if the patient says he has diabetes or hypertension or penyakit-penyakit kronik yang lain, ataupun rumah pesakit tu terlalu crowded, tidak ada bilik air yang berasingan or things like that, then pejabat kesihatan akan uruskan untuk pesakit ni dimasukkan ke hospital. If, however, the patient is young, is well, doesn't have penyakit lain, and rumah dia memang sesuai, ada banyak bilik, then the health office will ask the patient to come forward to the nearest COVID assessment center or CAC for proper assessment to be done by medical personnel to confirm that he's safe and can stay at home safely. Because it's very important that they come for assessment. I can't stress this enough because sekarang kita tengok dekat COVID assessment center kita, sepatutnya orang yang agak sihat, walaupun ada COVID masih agak sihat, patutnya mereka yang datang ke CAC untuk penilaian. Tapi dalam kebelakangan ni kita nampak pesakit yang datang kononnya sihat, tapi bila kita check, nampak tahap oksigen dalam darah dia terlalu rendah dan dia perlu bantuan oksigen dan perlu dihantar ke hospital dengan segera. Ataupun mungkin berat badan mereka melebihi, mungkin mereka obes, yang ini tak dapat dikesan melalui phone call daripada pejabat kesihatan. So obesity adalah satu faktor risiko untuk mendapat COVID terus. So kes macam ni pun kita kena hantar ke hospital. So kalau dia tak datang ke CAC, tak datang jumpa doktor kat mana-mana, dan mereka mungkin akan collapse kat rumah tanpa jumpa siapa-siapa.
Okay, and this means that there is a possibility of people who will succumb to the illness at home and die and be part of the numbers of the BIDs, right? The broad indents.
Yes.
That is very scary. Professor Adiba, you've just come back from hospital. What's the situation on the ground like? How many more beds have you opened at PPUM?
So PPUM is supporting the Ministry of Health with, looking after category 3, 4, and 5 COVID patients. We now have more than 200 patients at PPUM, including 35 in intensive care. It looks like we need to open more intensive care beds, but the issue is always the number of intensivists or number of doctors and the number of nurses. More importantly is the number of nurses. And this is in the setting where we've cut back almost all other services. PPAM is an extremely busy hospital, probably second only to HKL in Klang Valley. So we are only accepting emergency cases for non-COVID, so that theatre is essentially closed only for emergency surgery. But even with that, we're still struggling to open more ICU beds. So that is the situation. And just this morning, I did ward rounds and sent 3 relatively young people to intensive care for closer monitoring.
Yeah. And you are seeing younger patients, is that right, Professor Adiba?
I think that's because there's just so many people infected, right? So the more people who are infected, the more you're going to get those at risk. Not just the traditional 60-year-olds and above, but 30-year-olds who are overweight or with diabetes. They're the classic groups that develop, the severe phase of the disease very quickly. It may be worth just touching a little bit about the disease itself in terms of how in the first week or first 5 days or so, the symptoms that Vicky described, batuk, demam, sakit sengal-sengal badan, sakit tekak, is due to disebabkan oleh virus itu sendiri, as it gets into your system, terutama the upper and lower respiratory tract system. Tetapi yang membahayakan is selepas hari ke-7, ke-5, ke-7, it depends, sebab kadang-kadang it's very difficult to determine bila when is your day 1 of illness. So let's say dari hari ke-5 dan seterusnya is when we really need to watch, sebab this is when the immune system becomes overreactive, and the complications yang kita lihat dari COVID-19 is not exactly because of the virus itself, tapi sebab our own immune system yang overreact. And jadi mereka-mereka yang ada kencing manis and obese dan sebagainya are at risk sebab they have an immune system that's always primed. So when the infection comes, macam tak boleh break lah immune system ni, it just goes on and on and on, and then it causes inflammation di paru-paru, inflammation di hati, inflammation dalam the immune system itself dan menyebabkan clots dan sebagainya. So these are the people, and that's why early diagnosis, sebab then we identify mereka-mereka yang berisiko, dan ada juga blood test yang kita boleh identify those who are going to get worse disease.
Yeah. Kalau what Prof Adiba and Vicky have been talking about, apa yang mereka ceritakan tu sangat penting, ialah tentang timing. Sebab kadang-kadang kita tak pasti seseorang bila sebenarnya kontak dia. Jadi maknanya penyakit COVID ni on a day-to-day basis tu kena monitor. Tak banyak penyakit yang macam ni, dia boleh berubah day to day dia punya manifestasi penyakit itu, dan saya rasa itu yang penting. Jadi untuk home isolation tu, kalau katalah ward dah terlalu penuh, kita punya PKRC pun penuh, hanya orang yang tertentu yang kita yakin kita boleh bagi dia quarantine di rumah, kita boleh minta dia observe simptom-simptom, klinik atau hospital tak terlalu jauh, dia boleh pergi cepat, ya. Tapi yang penting tu, inilah sebab episod ni penting, kita kena tahu apa yang simptom yang sangat berbahaya. Bukan saja setakat susah nafas terus, sebab itu mungkin dah lambat, ya. Maknanya kalau tiap-tiap hari you tengok simptom tu progress, kita kena report back. Saya nak ambil, ada soalan yang tanya tentang cuaca di Malaysia. Adakah cuaca dan udara kini beri impak kepada COVID-19 dan cara dia dijangkiti? Saya rasa ini satu soalan sangat penting yang dikirim oleh seorang yang mendengar session kita ini, dan kita telah pun bincang in the few episode 2 episod lepas tentang udara. Tapi saya nak tekankan di sini bahawa Malaysia kita sangat bertuah. Kita ada matahari, kita ada peluang untuk keluar di luar, ya. Dalam misalnya kalau kita dapat makan dekat luar ke tempat yang, kalau tempat kerja kan mungkin tempat makan tu sangat kecil. Is lagi baik keluar di luar bangunan tu makan seorang-seorang dan masuk balik, daripada makan berdepan dengan kawan-kawan, tahulah nanti membawang lah apa semua, jadi air droplet semua terkeluar kan. Dan juga kita tahu bahawa udara dan sirkulasi udara adalah sangat penting. Virus ini sudah pun boleh bergerak dalam udara. Jadi inilah sebabnya penting tingkap dibuka di pejabat. Walaupun pejabat tu aircon pun buka juga tingkap. Kalau kita ada kipas, biar kipas tu tiup keluar udara daripada dalam keluar tingkap. Jadi ada beberapa benda yang kita boleh buat. Saya pun telah merayu kepada pihak Kementerian Sumber Manusia agar keluarkan guidelines untuk masyarakat, terutamanya mereka yang bekerja, untuk membuat kawasan pekerjaan itu lebih selamat dari segi sirkulasi udara itu sendiri. Jadi I'm just taking one of the questions that we are receiving now and bringing that. But that's a very important question. Mungkin Adiba can take this question with Vicky. At the moment, we see that there are young patients below 50 who have no underlying conditions ending up in ICU. So I want to know why.
So I think, like I said before, when you have so many people infected, that you're bound to get more and more, even the so-called classical risk factors, those with risk factors to have severe disease. So far, most of the ones that end up in ICU are still those with a high BMI or have diabetes. So, you know, COVID is such a complicated disease, and we have not fully we don't fully understand the you know, what happens pathophysiologically with severe disease. Even the whole cytokine response syndrome, you know, the one that I was trying to explain, where the hyperinflammation important, that's not the only, probably that's not the only pathology that happens, because in some patients, it's not the cytokine response that is driving the complications. So there are many things that we don't understand about this disease yet. So the most important thing is, yes, avoid yourself from getting infected and get vaccinated.
Okay, well said. But Dr. Vicky, can I just check with you, because you are one of the first people who will see a possible or COVID positive person. Right after what is the cutoff of your area of jurisdiction on these people? To the point of saying, okay, we suspect that you might be COVID positive, you need to go home and quarantine now. What else can you do? What else do our family medicine practitioners do?
What we do is, yes, those who we haven't confirmed yet, we tell them to go home and wait for the results to come out. But those who have been tested positive and they are waiting for the call from their health office, or they have gone, or they've been told to go to CAC, what we're having now, a new phenomenon, I guess you would call it, is people who come to CAC for assessment, and when they come and see the doctor, we ask them all the relevant questions. Adakah you punya pernafasan susah ke? Ada tak you penyakit kencing manis ke? Rumah you sesuai ke tak? And malangnya ada ramai yang sekarang ni ada phobia nak masuk ke dalam MySejahtera, because there have been a few viral videos about the not so pleasant situation in MySejahtera, which actually isn't true. It's just that a few people have viral these things really out of control. So a lot of people takut nak masuk MySejahtera. So dia akan mati-mati cakap, no, saya okay, saya tak ada demam, saya tak ada ni, saya tak ada tu. So when we categorize them down to class category 1 or 2A, which are those who are safe to be at home. So when they go home, we actually enroll them into an online home assessment tool system, where they have to actually answer questions twice a day regarding their situation, how their breathing is, how they feel and all that. And we find that when our doctors in our back office at the CAC, they monitor these patients, they go through semua pesakit punya jawapan, dan kita nampak beramai yang tiba-tiba cakap ada susah nafas, tiba-tiba mengaku ada kencing manis. So dia dah balik rumah, and now we have to scramble to find an ambulance to get them to hospital. Whereas if they had cakap betul masa mula-mula, from CAC itself, we have buses arranged to send people directly to MySejahtera, so they don't have to go through this hassle of going home and then susah nafas kat sana and then takut and all that. So again, kita merayu kepada semua orang, bila datang untuk assessment dekat CAC, bagi tahu yang keadaan yang sebenarnya. Jangan balik rumah and then bila teruk baru nak minta tolong, because I think our ambulance services are also really stretched out, and you may have to wait a few hours nak tunggu ambulance datang ambil.
Okay, that makes this is an address to our viewers on both Facebook as well as Astro Awani. The reason why we've wanted so much to speak about the signs of COVID is because we need to tell you all how important it is that you play your part in the first emergence of a possible infection in yourself. We don't want for you to end up in one of the COVID centers needing ventilation, needing to be intubated, simply because our health services are tremendously stretched. We are doing this particular session so that you will carry the message to your family and to your friends, and you will internalize the need to stay at home and do not diam when you are not feeling well at all. Even if it means that you are just recovering from the common cold or the flu, we need you to err on the side of caution and stay home. There is nothing really to do out there, honestly. We know you have cabin fever, but we need you to stay home. This is the only way we're going to stop this spread. And I know there are other questions coming in. We thank you for the questions. And Joanne Chow, we thank you for listening in and sharing the link. To all the people who are listening in, we thank you for your sharing of the links of our sessions. We know we have questions. We are going to take each of them now. Please be patient, because right now it's very, very important that Dr. Vicky's message of needing to be very responsible people at the first point of contact at family clinics, at your GPs, at the clinic Kesehatan's. You are the people who are able to break this chain of transmission. Please listen to our specialists and please take our messages to heart. So, Dr. Vicky, would an asymptomatic carrier finally display signs of COVID infection? And when they finally display these signs, what would the symptoms be? Would they be much, much worse than the normal first presenting symptoms? And if they had a longer incubation period, would the signs of COVID present with greater severity?
Well, actually, these asymptomatic people are the scary ones, because dia bawa kuman, dia tak tahu dia bawa kuman, and kalau dia tak duduk diam-diam kat rumah, dia akan spread, dan orang tak tahu pun dia dah spread benda tu. But we don't really know whether they're going to turn out worse or better, because many of the times we may never diagnose them to have COVID. They just go through the whole thing themselves. But in general, tempoh inkubasi for COVID is up to 14 days daripada masa kita expose kepada kes positif sehingga kita boleh menunjukkan simptom. Most people will have symptoms daripada hari pertama, dalam 4-5 hari daripada dia terdedah, dia will dapat simptom yang demam, batuk, sesama tu. Dan kebanyakan memang akan dapat simptom, kalau dia akan dapat simptom, dia akan dapat simptom by hari ke-11. But mereka yang dapat simptom yang lebih teruk, macam Prof. Adiba kata tadi, will be around 5 to 7 days after the infection, dan dia dapat susah nafas yang mungkin dalam 9 hari, 10 hari kena masuk ICU. That's a bit later. But yes, those who are asymptomatic, we can't really say how they're going to progress and how bad they're going to be compared to the symptomatic person. We just know that these are very, very dangerous people, because they're like walking time bombs who don't even know that they have a time bomb strapped to them. So mereka memang sangat berpotensi untuk spread COVID kepada semua orang. Keluarga mereka sendiri, kalau mereka tak berhati-hati, dia akan spread kepada family terdekat, bukan saja orang yang dia tak kenal, orang yang dalam rumah sekali dengan mereka. So that's why dia kena jangan pergi rounding all over the place dan membawa kuman.
Okay, so we know the broad possible signs of a COVID-19 infection: flu-like symptoms, body aches, fever, persistent cough. Are there other symptoms that are signs of COVID and yet do not always present? I think I've had a few people who have had COVID tell me that they did not think they had it because they were eating their food just fine and they were tasting things just fine.
Okay, we love people who have this sudden loss of taste or smell, because it makes it so easy for us to diagnose them. You're COVID, that's it. But you can't say that if I can taste and I can smell and I have a good appetite that I don't have COVID. So it doesn't work the other way. It only works one way for this question. So kalau you datang dengan apa-apa gejala macam batuk ke demam ke apa, kita memang kena assess keseluruhannya, whether you dah pernah expose kepada positive case, kalau you duduk kat Selangor, or you ada gejala-gejala lain. But the unusual or the less common symptoms of COVID would include things like diarrhea, abdominal, sakit perut, pening-pening, and kadang-kadang ruam juga. So some patients with COVID actually present dengan ruam-ruam kulit. So maybe they have dapat tumpuk-tumpuk merah kat kulit mereka, atau dia dapat macam gigit serangga dapat bengkak-bengkak, or urticaria-like lesions, or some of them even have discoloration of the fingers and toes, but these are a bit uncommon. So it's a bit difficult kalau dia datang ke klinik hanya dengan masalah kulit dan dia tak bagi sejarah dia ada demam, atau dia tak bagi sejarah dia ada rakan sekerja yang ada positif, mungkin doktor akan kata dia ni masalah kulit saja. So dia akan dibenarkan masuk ke dalam klinik dan dia akan dirawat oleh doktor yang mungkin tak pakai full PPE. And so patient-patient lain dalam klinik mungkin terdedah kepadanya. So sangat penting memberitahu mereka ada kontak ketat. Tapi basically it's for us in Selangor to have a high index of suspicion. Anybody who could be COVID is probably COVID. That's how we approach things now.
A high index of suspicion. This is terrible. The only high index I want to see is the KLSC. Prof. Adiba, you see COVID patients every day at PPUM. Do all of them have the same severity of symptoms? The reason why I'm asking is that with all our quarantine centers being so full right now, who makes the call to say, okay, this patient needs to go into quarantine, or this patient is so bad, they need to go into you at PPUM or one of our COVID centers. How do you guys make the call?
So that's what happens at the family medicine, the clinic kesihatan, at the COVID assessment center. If they come directly to us at our emergency department, then our doctors in the emergency department will make that assessment. So like what Vicky said, if they have been in close contact with someone who has a confirmed diagnosis, and they themselves are waiting for their swab results, I believe at CAC and PKD and all that will send them home to be quarantined at home. If they have a positive result, but are well, is 20 years old and otherwise well and all that, then the decision will be to ask them to isolate at home or to go to MySejahtera, depending on what Vicky was saying, the home situation. Kalau it's a young man who has who's confirmed to have COVID, tapi lives in a house with 8 or 9 other people, including atuk and nenek who are not well, and kakak ipar yang baru bersalin, and they live only in a 3-bedroom house with 1 toilet, then it would be more appropriate for him to be isolated dekat MySejahtera. Tapi if it's someone like someone who lives in a big mansion with 4 rooms and is able to self-isolate and is knows how to monitor him or herself, then it may be more appropriate for them to go, not just because they have a big mansion, but because they can isolate themselves away from the 6 or 7 other people around them. Because like we said in the past few episodes, the risk is higher indoors. So obviously kalau lebih ramai orang dalam serumah tu, the chances of infection is going to be high. Kalau you duduk berdua dalam rumah yang kecil pun tak apa, but you duduk berdua, tapi so lagi ramai orang dalam satu kawasan yang tertutup, yang sempit, lagi tinggi risiko. So that's when we would advise maybe it's better for them to go to MySejahtera. So yeah. So those who come to our emergency department, kalau the oxygen level is low ataupun they are already at day 5, day 7 and masih lagi demam and berbadan besar, ada kencing manis dan sebagainya, then we will bring them to the hospital.
Okay, thank you, Prof.
So if I may, because the reason why it's so important to like Vicky said, catch these people early is now there have been very, very good studies that show that mereka yang memerlukan oksigen dan have developed complications, by giving them ubat yang dinamakan steroid, which is a very cheap medicine, we can reduce the mortality. So this has been one of the most significant findings in treatment for COVID. Dan there's another ubat yang namanya tocilizumab. Malangnya ubat ni mahal sedikit. So what we do is we put them on dexamethasone dulu and watch them for 2-3 days. Kalau mereka masih memerlukan lebih banyak oksigen ataupun the blood test shows that the inflammation is still ongoing, we will add this drug called tocilizumab. So alhamdulillah, we do this early, then we stop the inflammation and stop them from going to intensive care. Sebab early detection, early monitoring is so important. There was a question on ivermectin. Maybe since I'm on treatment, I can quickly. So one of the difficulties we're facing with COVID, we have got this miracle, which is the vaccines. Tak kira lah Pfizer ke Moderna ke Sinovac ke Johnson & Johnson, AstraZeneca ke, these are all miracles, ya, sebab this is boleh katakan our magic bullet to, along with other things, to eventually stop the pandemic. Tapi we haven't been as good in terms of finding treatment. Yang saya namakan tadi is treatment to hentikan or to kurangkan the complications, tapi antivirals kita yang efektif kita belum ada lagi. Ingat tak masa zaman-zaman hydroxychloroquine tu, semua orang ingat hydroxychloroquine was going to be the answer, tapi tidak. So in a way, the ivermectin story is similar to that. Ivermectin ialah sejenis ubat yang kita gunakan untuk a few conditions macam river blindness, scabies. It's not specifically an antivirus. Yeah. So there have been some studies to show that maybe it works. Cuma, just like the hydroxychloroquine, we need bigger studies to really prove that it works, because some of these studies have biases and so forth. So it is not been shown to conclusively work yet. And we don't want to be using a drug that's not, I mean, it's used in human, but it's more used in animals to create another problem.
Correct.
So what's really needed is a big ivermectin study.
All right.
Sorry, Karen.
Yes.
Ivermectin study is being done in Malaysia by KKM. They're already doing some research, but there's now a lot of studies already emerged to show that it's not useful. And even the producer of the drug has also come out with a statement to say it's not useful for COVID.
Correct.
Having said that, if you are sick and you are desperate, right? People are desperate, so they will say that, oh, they took this, but then they got better. But unless you have proper randomized, controlled trials, then we cannot attribute that it's because of the drug. Maybe with any viral diseases, some of them are self-limiting. They actually get better by themselves without any medication. So I think that to say why aren't we using ivermectin, I have friends who also confront me on that. I say, look, if you want to take ivermectin, go ahead and do it, but no one's going to stop you. You can buy it from Shopee or whatever, but it's not scientifically proven. And the purpose of our program is to tell people we must act based on science and evidence. Is what helps us make good decisions.
Absolutely.
That's a good point, Jim, because remember 60 to 70% of people will recover. The immune system will help us recover. The asymptomatic and the category 1 and 2, and even the category 3 patients, not everybody progress to 4 and 5 without any specific treatment.
I think, but again here, I want to tell our viewers that, this kind of mindset that, hey, I know a lot of somebodies who've had COVID and they've recovered what? It's not a big deal. It's okay, ma, tak mati pun. But the thing is, it's not about mati ke tak mati. It is the fact that you have taxed our health system, which is already staggering. Our frontliners are on their last legs, and you don't want to be one of the numbers that just add to their burdens. And it's very, very important to treat the illness like you might die from it. And it's very important that if you are going to be part of this fight for it, for a freer, a more open Malaysia, you have to do your part. And part of doing your part is not so much as thinking that you are going to be okay because 5 or 10 others who are okay. Our deaths have risen. We've had the highest number of deaths ever in Malaysia a couple of days ago. It says something for the severity of this illness. So yes, despite the fact that Professor Adiba says that we will recover, the chances are very high that you will recover, that you will not succumb to the illness, you are still taxing the medical system. And it's very important that we continue to achieve as much controls as possible in our comings and goings. So Dr. Vicky, terdapat soalan daripada Facebook user kami. Berapa lama sebenarnya tempoh boleh jangkitan virus COVID ini? They want to know whether it's really 10 days, 14 days, or 21 days. And if it's 14 days of this period of infectiousness, kenapa tempoh kuarantin wajib ke atas pengembara dari negara tertentu dilanjutkan kepada 21 hari?
Okay. Well, the period of infectiousness now is actually 10 days. The studies have shown that after that, patients are not infective anymore. In the beginning, we didn't know. We thought it was 14 days, and that's why our quarantine period was 14 hari. Tapi sekarang dengan data yang dah keluar, kita tahu lepas 10 hari sakit dah tak infectious, so kita boleh benarkan mereka untuk meneruskan lepas daripada quarantine. Saya rasa yang quarantine lama dekat for people yang coming from certain countries tu is because mungkin mereka datang dari negara-negara yang ada apa yang kita kata variants of concern. Mereka mengidap COVID yang yang ada what's variants of concern in Malay, that one I can't tell.
Yang ada mutasi yang baru.
So dia dah ada jenis COVID yang berbeza sikit yang mungkin lebih bahaya. Sorry?
Yeah.
What was it?
Yeah, that's right.
Yeah, so variants yang lebih senang berjangkit, lebih mendapatkan simptom yang lebih serius, dan kita risau kita tak dapat menangani virus itu kalau tersebar dalam komuniti. So untuk kes-kes begini, tempoh kuarantin adalah lebih lama sikit.
Okay, that's fantastic.
Mungkin dalam isu ni saya boleh tambah juga sikit. Di hospital, jika seseorang itu masuk ke intensive care, biasanya kita memanjangkan tempoh kuarantin itu ke hari 21, just because they have more severe disease, just to be sure. So jika ada kematian, we just usually extend it to 21 days. So just to be absolutely sure bagi mereka yang have severe disease. So kalau ada family yang bertanya-tanya kenapa bila keluarga saya meninggal hari itu still 21 days, that's the reason. Dan sebelum ini tahun lepas, sebab the PCR test is very sensitive ya, so walaupun sudah hari ke-10, tetapi kadang-kadang ada orang tu hari ke-20 pun PCR masih positif juga lagi. So tahun lepas we used to quarantine sampailah PCR tu negatif. Ada yang berbulan-bulan duduk kat hospital. Masa tu kita tak tahu ya, tapi sekarang ni kajian telah menunjukkan walaupun PCR itu positif, tetapi the virus is no longer viable, is no longer infectious. Jadi 10 hari sudah mencukupi. Except bagi mereka yang really severe, kita extend to 21 hari.
Okay, I really like that. Thank you so much, Professor Adiba. So many questions about that, people wanting to know how long am I infectious for? How long before I can go back to my house, to live again with mom and dad, with my younger brothers and sisters. So viewers, you have now a concrete answer from Professor Adiba and Dr. Vicky. So definitely, if within a period of 10 days, you are all right, you are showing an improvement, you can say that in the 14-day period, you are no longer infectious. You can go back and be with the people that you generally stay with. But what about if the patient has one of the variants of concern? What happens then? Dr. Vicky and Professor Adiba, can you maybe share this question?
Yeah. Okay, sekarang ini the variants of concern kita belum lagi menggunakannya untuk individual patient management ya. Sebab satu, it's not easy to make the diagnosis and then to test what type of virus you are carrying, because it needs memerlukan genetic sequencing dan sebagainya. Apa yang the reason why we need to do the surveillance on the variants is because these variants can do 4 things. Satu, as we have seen with the B117 atau the UK variant and the B167, these variants mungkin menyebabkan jangkitan yang lebih senang, or it transmits a lot more easily. Kedua, the kebimbangan mengenai variants. Actually, we are going to have a Sense with Science just on variants dengan seorang pakar virology in a few weeks' time. But just very quickly, since we're on this subject, keduanya, it may be associated with more severe disease, but I think the data on this is still not conclusive, not like the transmissibility. Dan ketiga, variants of concern is dengan vaksin lah ini yang menyebabkan Tan Sri Jamilah tak boleh tidur malam ni. Seperti yang kita lihat, the reduced effectiveness of the vaccine dengan setengah-setengah variant. It doesn't mean that the vaccine doesn't work, but kalau nak compare 95% Pfizer dengan the wild type virus, the variant 70% umpamanya. Similar with AstraZeneca, which is a bit lower. Dan keempat ialah kemungkinan if you have been vaccinated ataupun have natural infection, then you get second infection dengan another variant, that your natural immunity may not be as strong. So this is the reason why we need to keep an eye on the variants. Tapi for individual patient management, it's not something we do or possible at the moment.
Dr. Vicky, would you like to add on to that?
Not really. It's basically, I think we shouldn't worry so much about what variants and what vaccine. We just need to make sure we just keep to the same principles of staying home and not getting any form of COVID.
Okay. To our viewers out there, we really thank you for the interaction. We're loving the questions and we're loving how you're listening to us and asking us on what we've just said. We also thank the viewer who has asked if Professor Adiba is well. We note that she might be looking a bit pale. Professor Adiba would like to tell you that she is fine. She's just a little bit hungry. I'll PM me. I'll send
Tan Sri Jamilah.
You would have seen me nibbling on food. I have not had lunch, so so both Adiba and I are a bit hungry. Sorry about that.
Yeah, I think we now have to send a food drop address every time we have sent signs to send food. Can we send food to this address? Coming back on, I would like to assure our listeners and our viewers that we are going to take the vaccine questions. Yes, there are very many of them which we have not answered yet, because we want to give the respect and the focus to Dr. Vicky speaking about signs of COVID first, but we will take your vaccination questions a little later on. So Dr. Vicky, do we rely on CT value to determine whether a person is still infectious or not?
We don't rely on it, but it is a guide for people who have, when we have cases coming in, let's say to the CAC, and they bring their results and they are not sure whether they're infected. They have one positive result, they have one negative result, because they've done it at different labs and things like that. We do look at the CT value. If they have a low CT value, then they are infectious, and we can use it to persuade them that you have a low CT value, you are more infectious, you cannot go home and stay in your crowded house, you need to be isolated in MySejahtera. So that helps us a lot in that part of the management.
Right, understood. Okay, Dr. Vicky, also, I don't want to be a fear monger, but there seems to be an increase of people who say they show just very mild symptoms, and then suddenly they take a very bad turn for the worse, and sometimes that turn for the worse ends up in death. Is this par for course for this particular virus? Or is it just something that's happening randomly?
Okay, this is not evidence-based. I don't have any studies to show this, but from our experience in our CAC in Shah Alam, which is the biggest CAC at the moment, when we did our CAC earlier in the year, we saw many patients coming in, but most of them were quite well and very few emergencies. But in the last month or so, these people who are supposed to be well and who are supposed to be just coming in for assessment are coming in, walking in category 4. They're coming in sometimes looking very well, but when we actually do the test, we check the oxygen levels and such, they have very low oxygen levels and they need urgent admission. So from a CAC which had no emergency bay, we have now a CAC with an emergency bay with 6 beds, with oxygen tanks, with 2 ambulances on standby, which are running every day almost continuously to hospitals, sending patients in category 3 and category 4. So yes, I would say that we are seeing more severe cases now. Maybe it's like Prof. Adiba said, there's more cases, so same way, proportionately you see more severe cases, but it is scary, and yes, maybe we should be fear mongering, because I think maybe fear will keep people in their houses, because everything else makes them feel like, oh, it's okay, I'm Kabal, nothing will happen to me. I would also like to say that in the last week, we saw 2 patients in category 5. The patient datang ke CAC untuk kononnya assessment, tapi collapse dekat pintu. okey, sampai BP tak ada, tak bernafas dan kena diberi ubat dan dihantar ke hospital dengan mengejar-ngejar. So harap-harap benda tu akan menakutkan orang supaya mereka sedar that sebenarnya COVID ni bukan benda yang sangat ringan, that you boleh mati dengan COVID, atau kalau tak mati pun you akan collapse dan you akan mengalami banyak penderitaan to you and your family. Because jangan lupa, bila dalam keadaan macam ni, you akan dikejar-kejar ke hospital seorang diri. Ya, family tak boleh ikut, family tak boleh teman you ke hospital, family tak boleh masuk ward tengok you, tak boleh pegang tangan atau sayang you or anything. You're going to be alone. So don't let it come to that stage. Come forward early. Let's get you tested. And like Prof said, there's treatment to be given if you come in early.
Absolutely. Very, very important then.
I have a question for Prof. Adiba and Dr. Vicky. Seeing that it's so rampant now, right? I mean, the virus is already around us, it's airborne, you know, all this terrible things that's going on. Would you recommend that people who can afford to keep a pulse oximeter in the house?
Yes, I was going to say that later on. I think there will come well, hopefully there won't come a point, but even now, as you know, my apes is so stretched already, and I think Vicky and I share the same idea that for those who can stay at home, can be monitored at home, should stay at home, and we should mobilize our general practitioner colleagues to help us all monitor at home and also utilize digital technology, which is already available. So specifically on the oxygen saturation, actually, yes, the answer is yes. This is a little device, Khadija or someone, maybe you might want to quickly Google.
I have one.
Okay, there it is, that we use in hospital, that you can buy from pharmacy or Shopee or Lazada, whoever lah. But be very careful, buy a good quality one. And it measures your oxygen level. And so the danger level is when it gets to about 95% and below. I can share with viewers here, I have two children, two boys, two young men who are studying in the UK, and unfortunately they came down with COVID around Christmas. However hard they tried, masa tu London, you know, everywhere you go there was COVID, and they were staying at home. They just went out to buy dinner at a fish and chip shop, and then the older brother got it, and then the younger brother got it. So they're fine now, but you know, I quickly called my friends in the UK to lend them the saturation meter, and they also bought online, and I was monitoring them from here, but also I've done that with a few friends here in Malaysia and also overseas using saturation meter. So I think that is definitely, Tan Sri, thanks for bringing that up. It's an important way.
So I bought two pulse oximeter. It's called a pulse oximeter. It's not very expensive. Just make sure you get a good brand. Look at the reviews and all that, right? And you can do some search. But you know, I've even started to give away pulse oximeters because I think it's useful for everyone to have one in case you catch COVID and you can. And the other thing I want to say is that, you know, some of my staff have caught COVID. And fortunately, even when they had received one dose of AstraZeneca, they did not manifest any symptoms. They remain very well, and they can be observed at home. So I think that it's very important that, you know, the vaccine message here I'm trying to make, you know, I think we are like, or sometimes vaccine central on our Sense with Science. Everybody comes and asks questions, which is great. We really appreciate that, whatever we can answer and so forth. So I think knowing the disease, understanding, you know, the evolution of disease, as Dr. Vicky and Prof. Adiba have mentioned, you know, you can come in walking and suddenly you collapse. The oxygen saturation is very important. So if you can monitor that, especially somebody who is older or has diabetes or is obese, orang yang gemuk ni, so I have to be very careful because I'm a bit fat. So you know that you know, my oxygenation is good. So I think these are so important, and of course vaccination. I think this is the only thing that's going to help us get through now this horrible pandemic.
Leading into vaccinations now, Dr. Vicky, can you tell us if in your in your practice, in your day-to-day ministering of people, that if you see somebody coming in who's already had their first dose of a vaccine, irregardless of what vaccine it was, would they present with lesser symptoms or no symptoms at all?
Yeah, if they've had one dose, they definitely present, so far the ones we've seen, very few, but yeah, much milder symptoms. And those who've had 2 doses, even if they haven't finished the 2 weeks after the second dose to get the full immunity, they seem to be presenting less. But the best thing I can say for vaccination is all my staff in the clinic have been vaccinated. So 1, they don't live in fear now, and 2, many of them have family members who are positive because the community, it's in the community, right? So husbands, wives, kids go to the tadika, come back, and then there's close contact and things like that. But because they've all been vaccinated, I haven't had to quarantine my staff. I've been able to keep running with the full quota of staff. Before vaccination happened, we kept running with, we have to keep quarantining our staff for 10 days, 14 days because they've been in contact with positive people. So we were struggling to run our clinic because staff were always not there. But this time around, since we vaccinated everybody somewhere last month or so, although many of them in our contact, every other day I get someone calling me and saying, okay, my husband is positive or my husband's office mate is positive, I can still tell them to come. As long as they're asymptomatic, we just let them come back to work. If they have symptoms, then we will test them. But yeah, it makes such a difference to running the health services since our staff have been vaccinated.
Thank you so much, Dr. Vicky. I see dots before my eyes. Professor.
Karen, sorry, dengan izin, Karen, I just want to show you. I love this graph from this infogram from Public Health England that was released about 10 days ago. I think dengan satu infogram you can see the difference with the vaccination program that's been rolled out in England. Yeah, so. Yang merah ni, it says estimated reduction in symptomatic disease, hospitalization and mortality. So this is just after 1 dose of either Pfizer or AstraZeneca. Kalau you tak vaccinated, merah ni, if you are vaccinated, in terms of symptomatic disease, look at how much difference it makes. Hospitalization in this second row and death in this third row. And look, if you have 2 doses, in this case it's the Pfizer vaccine, yang merah-merah ni unvaccinated for symptomatic disease, and look, only 1 dot in terms of mortality after 2 doses.
Oh my gosh, that's amazing.
It's amazing, isn't it?
Yes.
And this is after millions of people have been vaccinated in England, yeah, in UK.
Okay, Cho, one question. Dr. Vicky, if I am vaccinated and I get COVID, am I infectious?
The evidence so far says that if you have completed your vaccination and finished that 2-week post-vaccination period, your chances of infecting anyone are very, very low.
Okay, kalau I'm half vaccinated, first vaccine, and I get COVID, am I infectious?
That one I don't know the figures, but I presume will be kurang infectious daripada siapa yang tak pernah dapat vaksin.
Okay, but I am still under the onus of self-protection and protection of the community to stay at home, duduk diam-diam, and do my 14-day mandatory quarantine, correct?
So, kena rasa you infectious, you still have to do that because we don't know for sure. You know what? It might be 50% less, but which 50% are you? Are you the 50% who is going to be less infectious, or are you jadi 50% yang sama infectiousnya? So, you nak ambil chance ke dengan family? Janganlah duduk diam-diam.
Okay. Oh my gosh, this is a great question. I was going to segue into vaccinations now, but there's a question from GP who is inquiring on how they can help to monitor patients who are home quarantined. But they were told that only doctors who are trained to do COVID screening are allowed to do this. Dr. Jamila, maybe it's a policy question. Can I ask you to take this one? Does it take rocket science?
I think that's a question for Vicky because it doesn't make sense. I think that GPs are doctors who know their patients really well, and they must be involved. I think that, you know, it's no longer a matter of KKM or anything. I think every medical practitioner now has a role to help because, you know, the Ministry of Health is overwhelmed.
We're completely with you, Doctor. I think Vicky and I have been banging our heads to get this as a policy decision because it really, you know, it's just good on all fronts. But I believe Some of the barriers are, well, one is the training, the other is the payment, and the third is the paperwork. I've even spoken to Dr. Arasu from MMA, and he said, you know, he looks at the paperwork that needs to be done and he throws his hands up. So I think there needs to be a much better coordinated home monitoring system in place, and certainly GPs and you know, what I described in terms of my two boys in London who had this was that they're assigned a general practitioner who they can call on if their symptoms get worse. So we can do the same. We have general practitioner in just about every little mukim, every little suburb that can support our KKM colleagues.
Completely. Yeah.
Yes, we need to do that because we can't do it alone in primary care anymore. We don't have enough staff in the primary care settings. And yes, I think there is too much of, there's a lot of red tape and hoops to run through and fences to leap to get permission to do these things. Too many sharat that you have to fulfill to be able to do this. Like, I think many people would have read a lot of letter from the Academy of Family Physicians where they said that they've been vaccinating babies for years now, and he's probably vaccinated the ministers as well. So why is it so difficult for them to get permission to do vaccination for COVID? I mean, we're not talking about Pfizer. Okay, Pfizer is a very temperature sensitive and dose sensitive and stuff, but Sinovac, Astra, 2 to 8 degrees, any GP can have that in his clinic. Why don't we trust them? Why do we treat them like I don't know, outcasts? They're part of us. We need their help.
Yeah.
All right. So
The ministers just announced, right, 500 GPs to be involved in vaccination.
Yeah.
Okay,
There
that's
are
good.
there are thousands of GPs, not just 500. There are more
Yeah.
than 2,000 plus who have registered to be vaccination centers. I mean, for individual patients. But I will come back to why the delay and you know what we're doing now to ramp up. If you want to segue into vaccine questions now, Karen.
okay, just a little aside to thank this particular GP for writing in. Sir, madam, we thank you for being on the front line with us. You will have a necessarily more sedate opinion from the doctors on the panel. I'm the only non-medical, non-accredited personnel, but from a sense of a patient for continuum of care, I thank you because I believe that it's people like you who hold the line for the community. And especially if you're a private practitioner, seeing people in your neighborhood and you've been in practice in that neighborhood for a very long time, you would know them, their needs, and how best to interact with them much better than any other medical person in that field. So keep doing what you do. Keep up the good fight. And thank you. So
Yeah.
we're going to take a little bit of a segue into vaccination questions since those are coming hard and fast. But I thank the listeners and the viewers for being so good about keeping the questions hitherto to just our signs of COVID. Thank you, Dr. Vicky. That was an excellent session. Feel free to check in on the vaccinations part. But Dr. Jim, give us a broad overview of what's been going on in this week for vaccinations wise. Some numbers, some experiences.
Yeah. First of all, just to echo what Adiba and Vicky said, look, both Adiba and I don't work for the Ministry of Health. My role is even less important than Adiba and Vicky because I'm just an advisor. As you know, you can advise, but it's up to policymakers whether they want to take it. So my advice together with Adiba is consistently on how it must be an all of society approach. GPs are a critical backbone of our health system and must not be treated as separate from a health system. A health system is broader than just Ministry of Health. It's private sector, it's family physicians, it's even traditional medicine people. We need to look at every aspect, right? And I think that for the GP who asked these questions, and I see there was another comment as well from Wang Samaju, just do it. Just call on the patients, right? And if they need a reference, go ahead. Don't wait for permission to take care of people who are sick. I think this is our Hippocratic oath. We go ahead and do what we are meant to do as doctors. So, even though I don't work in the clinic, if anyone calls me, I will tend to the patient, because I keep my license alive, and I feel that it is my duty, and this is why I became a doctor in the first place. So just to put that to rest. Now, on the vaccines, I've been reading through all the questions on the vaccines, and let me start from the outset to repeat again and again. My only wish is we had all the vaccines we had now, so that we could have, never experienced this wave that we have. The reality is the orders were placed last year, and I think we did a very good move to actually split our portfolio. We signed on to COVAX facility, which is a one that is set up by WHO and Gavi and so forth in Geneva, which means that when the vaccines start being produced and they are verified, we will get, a right to the access to those vaccines. So this COVAX facility was actually set up to make sure that there are vaccines available also to poor countries. So that's a small portfolio we have with COVAX. And COVAX has a number of vaccines from AstraZeneca, Novavax, Johnson & Johnson, Pfizer, Moderna, and whatever that has passed through WHO. The second is we have Pfizer as a direct procurement, because Pfizer has a company here. So when you make an order, it works through its branch or Malaysian Pfizer company. And we increase our Pfizer portfolio because we see that it's very slow to get, for example, Sputnik approved or CanSino approved. So what we did was we ramped up our Pfizer portfolio now to 70%. So we will have a lot of Pfizer vaccines coming in. The third is Sinovac. So we put in an order for 12.6 million doses of, I'm sorry, it's about 32 million. So about 20% of our portfolio is on Sinovac. And that has been approved. And again, with any vaccine that comes into the country, there are very strict regulations put up by the National Pharmaceutical Regulatory Agency, or NPRA. NPRA is under KKM. It's very strict to make sure that three things are met. The vaccine is safe, the vaccine is efficacious, and the vaccine has a high quality. So WHO sets certain criteria. Any vaccine that is safe, that is efficacious and high quality, and does have an efficacy of more than 50% can be considered as a vaccine to be used for the public. So all the vaccines that you see us using now have met those criteria and more. So with Sinovac, for you to get a vaccine approved by NPRA, you need a product license holder. So Sinovac doesn't have a company in Malaysia, but Sinovac has a partnership agreement with Pharmaniaga. And therefore, Pharmaniaga applies for the license for approval for Sinovac, and is the distributor for Sinovac. So for the government, it cannot procure direct from Sinovac because it has to go through, because it doesn't have a Sinovac here. So Pharmaniaga is the representative, so to speak. Yeah. So now the vaccine started to trickle in. We got 100,000, we got 50,000 one week. It was very, because you must remember the whole world is looking for vaccines. Pfizer is now supplying 100 countries around the world. Now, why didn't we ask for Moderna and others? Because we had to make a decision on what our portfolio is. Moderna, for example, is 2 to 3 times higher than the cost than other vaccines. But nonetheless, the government has procured 120% of its needs. Why 120%? Because we calculated 70 to 80% to achieve the so-called herd immunity. But remember that 30% of our population is below 18 years old. So which means every adult in Malaysia has to be vaccinated for us to achieve herd immunity. This is a very important point people don't realize. So the good news, though, is that Pfizer has now said it can be used from 12 years and above, and they're doing more research now on younger children. So once we get approval for NPRA, we can lower the age of Pfizer recipients. This is why the 120% is important, so that we can do it among teenagers and hopefully among younger people as well. Then AstraZeneca, as you know, we also have that from the COVAX facility that I mentioned earlier, and it's a 10% of our portfolio. AstraZeneca had all sorts of issues. We were very unlucky because when our shipment was arriving, it was at the height of all the controversies of AstraZeneca. So people started to become extremely negative. So we didn't want to throw away the vaccine. So we said, okay, let's tell people, here are the Here are the things that people are talking about in terms of the science, but here are the benefits. So you can opt in to say that I accept this vaccine, and therefore that exercise of the opting in. We don't talk about MySejahtera and all that here today, right? That's not my concern. So what happens now is that we have a higher volume now coming in regularly. In June, we will get about 4 million. In July, we will get 10 million Pfizer. June, we'll have 4 million mix lah. Sinovac sikit, AstraZeneca sikit, and all that. And then, you know, from July and all that, it will start ramping up. By August, end of August, we will have 60% of our supplies in the country. So if we work fast from now that we have vaccines, we can start ramping up. If you want us to speed up and open drive-through, with what? What do we inject you with? We don't have the vaccines physically in the country. So now that we have them, then we can be innovative. We can start testing new approaches and so forth. So that's the hope, that by September, October, majority of all our people are vaccinated. Now, why didn't we do a drive-through in the first place? You must remember, this is a new vaccine. And it's been a miracle because people have come together, scientists have worked together at breakneck speed and collaborated to produce a highly efficacious vaccine. So we didn't know, right? When you started, you know that Malaysians were very skeptical. Even until today, only about 11 million plus have signed up. We need 26 million people to sign up. We're nowhere close to the 70% that we need. So let's not talk about herd immunity. We can't even get people registered now. So all of you listening out there, all of you are concerned, please, you know, use your circle of influence and get your friends, get your family all signed up for vaccination. So now that our volumes are increasing, we have to now ramp up. So we started with the mega PPVs, World Trade Center, IDCC, and so forth, which are giving a high number per day. Now, the Arizona drive-through has been the big hit, right? Now, you must remember, Arizona drive-through happened in winter last year. Arizona is a desert. So they are not doing it anymore. They only did it for a short time during the winter break because it was more, and it's very dry. So if we want to do a drive-through, can you imagine with the thunderstorms that we get, all your vaccinators are going to get very, very wet. Lightning is going to strike, you know, someone, God forbid. But, you know, but the reality is our geography, our climate is also very different and very, very hot, right? But we did ask, you know, a couple of centers to just try it out. And also because we didn't know whether people react very badly to the vaccines. So we want that observation period, 15 minutes is the minimum, whether they will get an allergic reaction or not. But now we are seeing that not bad, you know, we are not getting more allergies than any other country in the world. So we can start to slowly ease up, and, you know, maybe for the younger age group, lower risk, we can actually start doing more of this, you know, shorter observation and so forth. So we will ramp up. But having said that, Arizona did about 8,000 a day. We can do 9,000 a day in World Trade Center. So we don't need to put you through the stress of the drive-through and all that. But of course, you know, there were 1 or 2 days when World Trade Center became a bit, you know, klangkabut, and that is human error, something to do with the, you know, appointments and all that. But it's been settled, right? We're not saying that it's perfect, but it's been settled. And today onwards, it's going to be better. So I think for us in Malaysia, I'm not trying to defend the government because I think we're all learning through this process. But the role of the GPs and private sector will be very important now. So there'll be a distribution to GPs, to private hospitals and so forth to help us ramp up and reach as many people as possible. The hope is that, you know, by August, we will have the whole of Selangor and KL vaccinated. And the hope as well is that we ramp up, at least put one shot into people's arms first, right? Because it's very important for them to get some degree of protection, as Dr. Vicky and Adiba was sharing earlier, that, you know, we don't want people to come in and collapse at the door. We want them to have, you know, some mild form of disease that doesn't require you to go to ICU. Now, there was also a question about incentives and disincentives, the carrot and the stick. You know, the vaccine is a global good, right? And initially you would have seen everybody was very, you know, skeptical about vaccines. And then now everybody's upset that they can't get it fast enough. So I think our Malaysian public also is, getting worried. And this is a very important sign for us to be aware that, our rakyat is very, very concerned and scared. And I equally, so am I, even as a doctor, that my family are protected. So I think this is good that now that we can ramp up, hopefully. And then we've been doing it according to vulnerability. So what we said is that because the older ones, the ones with high blood pressure, the diabetes, the obesity, they are the ones who, when they fall sick, they fall really, really sick. So we need to protect them first, right? So this is why we did a staged approach. The frontline workers first, otherwise people like Vicky and Adiba cannot be there to serve us. And then the next is, getting the other groups vaccinated as well. So I know among the people who sent questions, there was someone with OKU. I promise you, we have looked into this very seriously. We've spoken to Senator Ras Adiba to say, please help us make sure that we don't miss out any of the OKU. We have been going to elderly care homes. We've spoken to Manto to help us. We are even doing door to door now through NGOs, Malaysian Red Crescent and others to help Ministry of Health, because Ministry of Health staff are so busy because they're also managing the COVID crisis. We are also, making sure if anyone who's older, who's been missed out, I saw a question that, the hotline is extremely difficult. We just had a meeting this morning to say it's unacceptable if the hotline is, not being reached. So I hope that in the next couple of days, it will be improved. And then also, of course, that, on the AstraZeneca question, I promise you, if you were successful, you will get an appointment. It will. They are now sending out the appointments through SMS and onto the MySejahtera platform. Everything is captured. It's in the database. I don't look after MySejahtera, although I get 101 questions, and I'm so IT illiterate that I'm the wrong person to ask. But I convey all your concerns to the team. I promise you, every time we have a Sense with Science, I come next day with a list of things to feedback to KKM, to feedback to the vaccine team, because everyone is just, really wants to help every Malaysian to get their vaccine. And I think that, there will be a lot of people who will be upset that, we can't meet every single one of their needs. You have a right to be upset. I'm not saying that you don't have a right, but what I also urge you is, highlight it to us. You are, if you come and join us every Sunday, you highlight your concerns. I will bring your concerns to the relevant parties. So that's another very good reason to watch us. But I think rather than incentives, like the biggest incentive is you will be well. And you can, if you're all fully vaccinated in a family, you can hug each other, right? In a family setting, if every single member of the family is vaccinated. And that, the other thing, of course, is should we have disincentives? This is a big question, right? Well, in some countries, if you don't have the vaccine, they may not allow you into a public event, right? We've been debating this, the rights of people to have mobility and so forth. But maybe the government will have to take a more strict measure. If you don't, get vaccinated, you can't do certain things. So similarly, as a Muslim person, let me share that anyone going for Hajj, for example, must get their vaccine. So everybody's queuing up. So, that was the incentive, right? Because it's something that's personal to you. You want to do it, therefore you make the effort to get the vaccine. But the main incentive must be that we want to get out of this pandemic. We're tired. I
think the main incentive is you don't want to die from COVID-19.
I didn't want to be so dramatic.
That was my incentive.
I didn't want to be too dramatic, Adiba. Always try to be positive in this show, right? But yeah. Yes, absolutely. We don't want to die when, of this horrible disease. I mean, it's horrible. Adiba, who is there facing the intensive care patients, I mean, you will know that, I've worked with Ebola. You are sick alone. It's a very, very undignified sickness. And then you die alone, and you are also buried alone. It is one of those most depressing situations when you think about disease. You can die, but you may be able to die with your loved ones. But this way, everything, you're on your own. And for someone who's mourning you, you can't even mourn properly because you're not there to hold the hands or to say farewell. What the most heartbreaking is, nurses putting WhatsApp videos or FaceTime to people to say goodbye. I mean, this is this is a terrible disease, and I think that we will, I can promise you the vaccine task force is working as hard as it can, uh, with now the great relief that a large volume will be arriving, and God forbid there are no shipment delays and all that. But we want to get these vaccines into everyone's arms, and especially I think where we live now in Selangor and KL is just everywhere. We just need to get it into everyone's arms, right? I mean, it's very, very dangerous. So I hope that I've answered. There's a question that was asked about mixing the doses, right? So at the moment, the Pfizer has not. People are still experimenting now. Just let me just put that first. When I spoke to Josh Gao in the China CDC, he was saying that we have to look into possibilities that we may have to give first dose a certain vaccine, second dose another one, and that was in the context of maybe for the variants, yeah, that you might want to have greater efficacy with two different types. AstraZeneca, for example, in the UK, they gave AstraZeneca first dose. They've been giving Pfizer the second dose to some people, so it seems to work. So anyway, what I'm saying is that we are still looking at the research. When we get our supplies, we will have enough to then vaccinate our population. As I said, we have 120% of our supply procured.
All right. So we're coming to the end of the session now. I've learned a lot today. Thank you, Dr. Vickneswari, Ayadurai, Dr. Vicky, family medicine specialist, for being on Censored Science. I think it was very much needed to have somebody who was front-facing, somebody who saw patients from the get-go with us today and sharing the science, both common and less common, on COVID-19 symptoms. Can we have a few final words from you, Dr. Vicky, please?
Yeah, sure. I'd just like to remind everyone that we all have a part to play in combating this pandemic. Kena ingat ya, kebanyakan orang sekarang tak dapat common cold biasa sebab kita kebanyakan masa pakai mask. So kalau kita dapat gejala, simptom-simptom flu, demam, batuk, sakit tekak, hidung berair, dan kalau you ada sakit badan, rasa letih lesu, kalau tiba-tiba hilang rasa bau, rasa, then kemungkinan anda mengidap COVID, dan please come forward to the nearest facility dan dapatkan pemeriksaan untuk memastikan ya ke tak. Dan dalam masa tu, please stay home and isolate yourself. Jangan pergi berjalan-jalan. Kalau dah dapat susah nafas atau pening teruk atau tak larat sangat, you rasa you tak larat datang klinik sebab tak larat, masa itulah you kena datang ke klinik, because kalau tak you akan collapse kat rumah dan akan datang jadi BID di rumah, ya. And please minta tolong semua orang, please tell the truth bila you come forward. Bagi tahulah gejala yang sebenarnya, bagi tahulah konten yang sebenarnya, supaya kita tak boleh bantu kalau kita tak ada the whole gambaran, ya. So jangan masuk ke bangunan-bangunan dan potentially infect semua orang dalam bangunan itu. Kalau healthcare worker semua kena COVID, nanti siapa nak jaga tuan-tuan semua? Okay. And lastly, I think I would like to say to the healthcare workers out there who have been tirelessly working, not from home unlike everybody else in the world, but from their front line. Thank you for all your efforts. It may seem like it's a thankless task, a losing battle, but you are making a difference. We have to hang in there. One day it will pass. This too shall pass. And you can proudly tell your kids and grandkids that I was there living through this greatest pandemic, hopefully the only pandemic that we have to live through, and that you did your part in ending it.
Yes, that's fantastic. Thank you so much, Dr. Vicky. That really touched me. And yes, a big thank you to all our frontliners and our healthcare workers and your teams as well, Dr. Vicky, at the front lines. Professor Adiba, your closing remarks, please.
I don't think I can do any better than what Vicky has said. Just to say that please help us to spread the message of, what Vicky has said. If you're unwell, stay home or get yourself tested, or seek advice if you're really, really unwell, and also help people around you to get vaccinated, to get registered and vaccinated. And please also help us debunk all that nonsense that goes on WhatsApp with the anti-vaccine movement.
Spot on. Thank you so much, Prof. Dr. Jim, your final closes, please.
No, I think Vicky said it all, right? I spent Hari Raya in Sungai Buloh Hospital, and I had tears in my eyes, just thinking about how the healthcare workers have just gone on and on and on, and pleading with the public to play their role. And I think we have every responsibility to do that. I think that our rakyat can do better. We can all do better. I think this is the time we rally together, forget everything else. We have one common enemy, and that is this SARS-CoV virus. And let's not give it a chance. Together, we can beat this, right? So behaviors are extremely important. The best medicine in the world, the best ICU in the world is not going to end this. It's going to be when each and every one of us, demonstrate the right appropriate behaviors. We keep ourselves safe. Please do not go out unnecessarily, and get the vaccination.
Absolutely. We'd like to thank our viewers and everybody who's participated in this. It's very important and it's very heartening to see the engagement that we've gotten from our community. Both Dr. Jamila and Professor Adiba are very, very glad for the kind of feedback that we've been receiving, and for the guests who've taken their times off on Sunday when they should be having their little siestas to be with us. So this has been Sense with Science, a project piloted by Tan Sri Dr. Jamil Mahmud and Professor Adiba Kamruzaman, supported by Pusat Perubatan Naluri and Astro Awani. I'm Karen Michaela, urging us all to continue staying safe, working from home, by keeping our hearts open to helping where you can. So stay united, Malaysia, stay safe. See you all next week. Thank you so much, doctors. Bye.
Bye.